Hey, 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 everybody. It's Dr. Lisa L. Campbell back. Week 6 Introduction to CPT Coding, Chapter 18, which is Lecture 4 of 5 for this week. We are getting into the eye and ocular adnexa. You know the deal by now, right? We have the abbreviations, the terms, the common procedure, guidelines, anatomy, blah, 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 blah. Let's get started with the different body parts. And so, first up, we have the um, lacrimal gland. Oh, you know what? Something else. I want to tell you this before I get it here. So, when I learned anatomy, one of the things that my instructor, and this was 1992, mind you. I know you're thinking, 92, how old are you? Old enough. All right. So, the eye is mostly contained in the bony orbit of the facial bones. I mean, look at your own face, right? And it is the structure that allows transmission of images to the brain for vision to occur. There are guidelines and more guidelines that you need to ensure that you're reading for correct coding. All right, so the anatomy of the eye. There are, you know what? It's so many parts of the eye that I don't even think the eye gets credit. The white portion of the eye is called the sclera. I think that's the one that we all kind of, we're familiar with. And then um, that fibrous membrane serves as a protection for covering the eye, and it also maintains the shape of the eyeball. Then we have the iris. That's another part that I think most of us recognize. And that is the colored portion of the eye. Then we have the pupil. That's the center of the eye. The pupil controls the amount of light that's entering the eye. Then we have the conjunctiva. This is a colorless mucous membrane that lines the anterior part of the eye. Tears, we all cry from time to time. I love me a good cry, are produced by the lacrimal gland and drain from the eye through the lacrimal duct. It makes sense. The lacrimal duct is located in the inner edge of the eye. The eyes are covered by upper eyelid, lower eyelid, which keep the surface of the eyeball lubricated and protected from particles. And then the eyelashes, which are located along the edge of the eyelids, they protect the eye from foreign body. And as I think about, as a person who wears contacts, mascara, I'm thinking about how powerful the eye is. All right, back to business, right? Cornea. Cornea is a transparent non-vascular structure that's located on the anterior portion of the sclera. The layer just beneath the sclera is called the choroid, which contains capillaries that provide the blood supply and nutrients to the eye. Posterior to the iris, you have the lens, which is a colorless structure that allows the eye to focus on images. And I know you're like, why? Okay. Why do we have to know this anatomy like this? Well, when I was thinking about, posterior to the eye is the lens, I think about what could happen to many of us as we age. You got to get your cataract removed, right? And so just knowing where things are helps you code better. All right, let me hurry up. Let me hurry up. All right. So I talked about the iris. Oh, the structures that are responsible for adjusting the lens are the ciliary body and muscle. Attached to the ciliary body and muscle are the suspensory ligaments, which are attached to the lens and hold it in place. The nerve cell layer of the eye is the retina, which changes light rays into nerve impulses. Impulses are transmitted to the brain by the optic nerve. And on the optic nerve is a blind spot known as optic disc, which is the point of entry for the artery that supplies blood to the retina. All right, yeah, we got these abbreviations. Definitely something that you need to know. I love this book. It's simple. Some people say it's too simple, but I let me just say this. Let me just say this. I think with coding, it's important to, start at the my nails cute. Oh, okay. Focus, focus, focus. You get delirious when you're doing all these lectures. I think it's important to start at the bottom and then go higher with coding, because sometimes if you start too high, let's just face it, all of us, we learn at different levels, and just starting from here and going up here is lovely. All right, so back to the abbreviations, and here are some more, and we move away from here. Now, if you don't know by now, you should know that there are so many instructional notes. And one instructional note in particular tells you that for diagnostic and treatment ophthalmological services, see the medicine section, because there are some codes here. So I like to say, I'm going to come back over here for a minute. I like to say that here, you have the surgical way to treat a problem. And then over there in medicine, which we haven't gotten to yet, you have the test to diagnose the problem before you can get the surgery. But then you also have like less invasive treatment options. Okay, that was all I wanted to say. All right. So next up, let's look at some procedures completed on the eyeball. We have procedures such as evisceration, evisceration, which means removal of an organ. And in this place, it's removal of the um, ocular contents. Then you have enucleation, enucleation. That is removal of an organ. I'm sorry, it's not removal of an organ. It's removing without cutting. So evisceration is removal of an organ. Enucleation is removal without cutting into the structure. And this is all in these codes. And then we have exenteration, exenteration, which means surgical removal of the contents of the cavity. I think it's important to note that the physician may vary in terms of what words they use. So you just need to know all the words so that when you see them, you can pick up the correct code. Okay. All right, let's keep on going. So we have secondary implant procedures. These are performed inside and outside of the muscular cone. You're going to see words like ocular implant, that's inside the muscular cone. Orbital implant, okay? Those are implants that are outside the muscle cone. Then we have repair of lacerations of the conjunctiva and cornea. And those codes are differentiated based upon if the patient um, is hospitalized or not. Oh, and I already told you about ocular and orbital, so we'll just keep on going. So I told you about this too, repair of the laceration. See, that's me doing too much. I had too much caffeine today. So repair of the laceration and the conjunctiva, you see the range there. There are some notes that are important for you to review. All right, procedures completed on the anterior sclera. These are organized according to the structures that are found in the anterior segment. So you see cornea, anterior chamber, so forth and so on. And then they're further organized by the type of procedure. So incision, excision, removal, destruction, repair, etc. All right, so now let's talk a little bit about lens procedures. And I mentioned cataracts, and the book is going to talk about cataracts. Listen, as a person who is in their 50s, I've had to take my father and somebody else to get their cataracts removed. So, yeah, it's a whole thing. All right, so the cataract procedures do have some notes that are present in the beginning. And these codes are divided based upon how they are removing the lens. So you're going to see terms like extracapsular extraction, intracapsular extraction. You're going to see words like phaco emulsification. So you want to read the notation that appears right before that code and um, really identify what was actually done. Also, it should be noted that bilateral cataract extraction should not be performed on both eyes on the same day. And this is to prevent bilateral vision loss if the procedure were to have complications. Heck, makes complete sense to me. So, the difference between extracapsular and intracapsular, you see in both you're removing the lens, but extracapsular, you're not removing the posterior capsule. With intracapsular, you're removing the capsule. That makes complete sense, doesn't it? All right, then we have procedures performed on the posterior segment. The codes are divided by anatomical sites. So you see vitreous, retina, choroid, etc., sclera. And then procedures performed on the orbital adnexa, or not orbital, ocular adnexa. You also see are organized by sites, right? Extraocular muscles, orbits, eyelids. Um, and then you have procedures that are performed on the muscles surrounding the eye. And so here, that's where you're going to see where people have like strabismus surgery. All right, so procedures performed on the orbit. Procedures performed on the orbit are further subdivided based upon um, if it's an exploration, excision, or decompression. In the textbook, they talk about some great terms to look for when you're locating these codes. Orbit, then implant, orbit contents, then aspiration. They give you lots of options to help you look up the codes because I think in the beginning, that's like one of the most challenging parts. All right, chalazion. A chalazion is a small tumor of eyelid that is formed by retention of secretions of the meiobimin gland. These codes are assigned to report the excision, which are differentiated by the number of tumors removed, the eyelids involved, and whether or not general anesthesia was used. And you notice something? whether or not the patient was hospitalized. All right. Procedures on the conjunctival and the lacrimal system. You see things like conjunctivoplasty. You see tear duct and rhinostomy. So that's that artificial opening. And voila, we get to the end. And we did all these things as usual. I'll see you back for the last lecture, which will be on chapter 19.